Hi, everyone. Welcome. We'll give it a minute as people are joining. But welcome and thank you for taking the time to be here for our second webinar session of this year with Dr. Kathryn Graham, who I will let introduce herself when we get to her portion of today's webinar. But we'll give it a minute before getting started. Hope everyone's staying warm and safe and cozy wherever you're located. Is particular those in Canada. We know the winter months are quite unpredictable. All right. So since these webinars are now 1 hour, we will jump in, but acknowledging that some of you may be joining just now or as the webinar is ongoing. So as I said, welcome to Dr. Kathryn Graham, and thank you for being here today for our February 2026 webinar. The title of today's webinar is Frontiers in Demonstrating and Communicating the Impact of Health Research and Innovation. My name is Vanessa, and I have the privilege of being the facilitator for KBHN's implementation science community. And these webinar sessions are co-hosted with the Child Right Network, and we'll learn a little bit more about both of these briefly before getting started today. So prior to getting started, we want to take a moment to give gratitude and acknowledge the lands in which we all have the privilege to work, connect, grow, and do our great work and activities, such as today's session. So I'm joining today from Treaty 13A territory, which is the city now known as Mississauga in the province of Ontario. But my primary affiliation is with McMaster University in the city now called Hamilton. And here is a beautiful wintry photo from the city, which is located on the traditional territories of the Mississauga and Haudenosaunee Nations, protected under the Dish with One Spoon Wampum Agreement. So as KBHN and Child Right are national in scope and reach, we give gratitude to the many lands and acknowledge the traditional territories our networks work and operate on. If you'd like to share where you're joining from and a bit about your locationality in the chat, we encourage you to do so. If you're still exploring this and the treaties in your area, we encourage you to check out the link at the bottom of this slide. So very briefly, for those who've joined many of these webinars, you've heard this spiel before, but for those who are new, welcome to our community. KBHN's implementation community comprises both webinar sessions, so public sessions like today, and a smaller closed community group that includes KBHN-funded project teams. The goals are to really build implementation science and practice capacity among the KBHN community, but also broadly in the neurodevelopmental disability community through sharing sessions like today. We aim to learn and reflect on different community identified topics in the field of implementation science, and overall aim to build connections, grow together, and advance the field of implementation science in NDD research. If you're interested in learning more, you can use the QR code to check out our community webpage.
Thanks, Vanessa. Hi, everyone. My name is Katie O'Connor, and I'm the Communications Manager at Kids Brain Health, and I want to welcome everyone on behalf of KBH Plus. So KBH Plus represents 3 entities that are working together to build better outcomes for kids. Our network is funded by the federal government through the Innovation, Science, and Economic Development Canada to drive innovation, implementation, and impact. Our foundation is powered by philanthropy to increase access for kids and families across the country. And our innovation fund is catalyzing the private sector by building a commercialization pathway for startups that are supporting neurodiverse children and families across the country. And of course, together, we are building a community and investing in resources to ensure our sector has the skills and knowledge they need to advance outcomes for kids And of course, everything happens in partnership, which is why we are grateful to be these building and leading these implementation sessions with ChildBright. And before I finish, I'd like to plug our KBH Plus conference that is happening in Calgary this October from October 18th to the 21st. And we're very excited that we've launched our call for abstracts. So be sure to check out our website to learn more and, of course, apply. So thank you, everyone, so much for joining. And over to you, Sylvia.
Hi everyone, I'm Celia Lar. I'm the co-lead of the Training and Capacity Building initiative with through ChildBright. So very aligned in terms of our aims and our support through the ChildBright network. So next slide. ChildBright is a network of continually growing with over 500 members, and we really highlight our partnerships and co-working with individuals with or partners with lived and living experience, and particularly for youth and their families with NDD. So you can see the very strong alignment between these initiatives, and are really pleased to be partnering around implementation science, so we can really foster that shared learning through these sessions. And I think that is good. I'll happily put the link for ChildBright if you're interested in learning more.
Thank you, Celia and Katie. All right, so today during the webinar, we just kindly ask that you share any questions and comments in the chat, and I will just double check that that's working a-okay for everybody. If you would like to unmute at any point, we ask that you raise your hand, and then I can request for you, or I can unmute you directly if you'd like to share verbally during our question and discussion period. So let me just make sure that the chat is working okay. I see people using it, so all should be good. And very quickly, before getting started, we just want to do a quick Zoom poll. So inclusivity is one of the core values across KBH Plus as well as ChildBright. We humbly acknowledge that we're on a journey to learn and do better and reflect on how to embody inclusivity in our activities. So to get a better sense of who's in the space today, I am going to launch a quick survey question, just to share a little bit about your identities as you are comfortable. And then the second question, which you should be able to see if you just either scroll, or it should appear in a second page, but I think you can scroll, is around your knowledge level of the topic entering today's webinar. So I'll give everyone a moment. And I won't share publicly just because of people sharing some identity-based information, but Kathryn, so you're aware, we're getting a range between, so they're asked to rate between not at all knowledgeable to extremely knowledgeable on a 5-point scale. Some people, most are saying somewhat knowledgeable. We've got a couple neutral, and a few people knowledgeable. So a bit of a range there, but no one not at all knowledgeable and no one extremely knowledgeable. All right, thank you, everyone. I'll end the poll and then I'll pass it over to you.
Thanks very much, and welcome everyone today. I hope you're not too cold. I'm a professor at the University of Calgary in Research and Innovation Impact Assessment, and really an honor to be here today, and thank you for the opportunity for this invite. And really, this is kind of part of the dream, is kind of working together in how do we get to better outcomes, or how do we enhance our outcomes and impacts in bringing kind of the community together in terms of the science and the practice, and really the role of kind of knowledge mobilization, implementation science in getting us there. So this is a dream for me to be part of this conversation in kind of being in a big tent. Next, please. So I'm just going to go over a few kind of key concepts in terms of, in the context of research and innovation, how impact is defined, and also what are kind of the latest conversations happening around how to better demonstrate and communicate our impact. But ultimately, kind of the proposition is as we work together, if we're enhancing outcomes and impacts, actually it's then easier to demonstrate and communicate. So next, please. So just to break the ice and to kind of start off with, I'm going to be monitoring the chat. Vanessa's kindly helping me with all the slides. And just wanted to hear from you any movie you've seen lately or any new movie, because I want to hear what I should be looking out for. And I was recently on a flight and watched The Roses. So that's one movie I've recently watched. So I'm just going to look here in the chat just to see what you've been watching or your favorite movie. Okay, yeah, Hunt for the Wilder People. Excellent, excellent movie. Mighty Wind, yeah, just watched that a few days ago. Very funny. Yeah, excellent. Okay, okay. Good. Thanks, guys. Now you're on my movie list. Thank you. Without limits. Excellent. Thanks. So great, just to kind of break the ice, see what's happening. And now we're going to talk about impact. So next, please. So there's many definitions of impact. In terms of this definition, what it's really pointing out for us is that impact is not always positive. That's where, of course, our focus is. And so when we're thinking about it, we need to think about unintended consequences or negative. It also positions impact in terms of that kind of long-term effect, so what ultimately are we trying to impact over time, and kind of the now what, so what. And of course, particularly today through this webinar, we're interested in not only the long-term effect, but how do we actually get to outcomes and impact. Other definitions talk about the type of dimensions in terms of impact. So they talk about impact in terms of health, social, environmental, economic. So very many definitions. I'm just watching. I'm just watching the movies. E.T. Yeah, excellent. Okay, next, please. This is only just a reference. This is from the Canadian Academy of Health Sciences, and they talk about health impact in terms of the health status, determinants of health and healthcare systems, and then they break down those subtypes. So just a nice reference when we're thinking about how other people, other frameworks are considering impact. And just as a reference, they have a Canadian Academy of Health Sciences report associated indicators with all their impacts. So just kind of a reference in terms of in Canada, what one framework and health communities are talking about with impact. Next slide. So I would say there's actually quite an increase in interest in impact. I was previously with Alberta Innovates Provincial Research and Innovation Funding Agency for 17 years and kind of in health, non-health impact for a long time. And I have to say, I find probably the last 2 years a real increase in the interest in impact and also expectations around impact in terms of what is the impact of the research, of the work we're doing. And in terms of impact, doing that, there are many benefits, particularly thinking about who is being impacted by the work. So kind of really thinking of impact, not just as what is the impact, but who are we benefiting and who benefits from this work. And I don't know, maybe in the chat, if other people are finding that there's increasingly more conversations in this area in impact in Canada. Next, please. So there are many purposes for impact, and a lot of the work I do is assessing impact. And I just find this heuristic very useful in understanding people's interests and focus, because when you're having the conversation, it really helps you understand kind of what's keeping them awake at night. So accountability is one, advocacy is another purpose, particularly from a funder's perspective, how the money gets allocated or invested across different areas. Analysis and learning, I think, is a big one, particularly with the implementation science community and the community I'm in terms of enhancing it, acclaim, and adaptation, another kind of big one, particularly also with implementation science, how we learn and adapt in terms of our context, etc. One I have added in is alignment. Just working across many organizations is aligning to the shared purpose and impact, so everyone's on the same page. Next, please. So I'm just going to pause here, and Vanessa will if you want to kind of add to this. But I'm just going to start with the first question. And given your work, when you think about it from your perspective, what does it mean to you? So kind of what is the impact you're interested in, or how would you describe the impact to you? So I'm just going to start with that. And then I'm going to look at the chat here to see what impact means to you. There's no right or wrong answer here. It's just, the greater good. Yeah, for whom? Yeah.
Exactly.
The making a difference. Yeah. Yeah, the intersect between different groups.
And Kathryn, I'm wondering, like, you're given your vast experience and expertise, do you find sometimes, like, even within a single project team, and you pose this question, depending on people's experiences, their roles on the team, like, does how impact, or what does impact mean, look different for the different people on the project team? Like, do you sometimes see that? Yeah.
Yeah, I see it a lot also too, different perspectives on what we value.
Yeah.
Also comes out, and then different, what co also comes out, people have different impacts of interest. So when you're working very collaboratively, then how do you give voice to it, but how do you demonstrate that the plurality of perspectives?
Yeah.
Yeah.
Beautiful.
Uh, Excellent. So great comments there in the what impact means to you given the work you're doing. Excellent. The other thing tied to it, and you're saying it already, is kind of who are you trying to impact, and it's coming out as well in the comments. In terms of assessment, and I see it in the comments, when people, when impact is assessed, and the quality of the impact, two criteria that are pretty consistent is the reach, which is coming up here, and the reach can be local, national, international. A lot of debate now that that local impact really matters, not only the international. So that's a big one. Yeah, and at the families. Yeah, this is excellent. And then the other criteria used kind of is the significance of the impact. So not only the magnitude, but sometimes the depth when we're talking about different populations. Next, please. The other question is, given your work, like you said, Vanessa, we're working in many roles and working on many projects. So some of you may be working and thinking about impact from your individual project. Some of you are working in a team or across departments, working on demonstrating the impact. Some may be looking at it from your organizational point of view, and then in the ecosystem, across a lot of different sites and provinces. And some of you may be working on all of them. So just wanting to get a sense in here when you're thinking about impact on your work, are you thinking of it mostly on the project work you're doing, or or are you involved with multiple projects? So just again to get a sense of that.
And it's interesting because I feel like with not all, but like many implementation initiatives, the goal is for that where relevant, like the organizational implementation, but also thinking about impact in terms of, is it sustained over time? Is it equitable, like reaching who, like thinking about the families in which the program or innovation is reaching, but also that system level, right? Like there's always those goals. So I kind of see connection across these various levels depending on the stages of implementation.
Yeah, so there's a mix of micro, meso, and also macro. And again, this is very important because we want to kind of understand what the levels we're at and the relationships. And yeah, totally, we're zooming in and out, micro to macro and macro to micro. And so a lot of the work that I do is kind of describing individual projects under a certain theme in terms of the impact, because one project alone cannot affect an impact, but over time that project has kind of the term the micro impact. So so very good, and that is very important particularly when we're wanting to demonstrate our impact as well as communicate it, because we need to make sure the indicators and the measures that we're using to demonstrate is at the right level as well. Next, please. So, next, please. So I'm just using the mountain analogy as the idea is we're working together across communities and disciplines to get to impact and across levels. Next, please. And so I'm just going to go through kind of these 6 stages and kind of just describe some examples as we go through it. I use the 6 stages because I work with many organizations on embedding impact strategy and implementation, and it's always fit for their purpose or their mission. So the 6 stages are agnostic, but then choices then are made along the way. So given the work I do and kind of very focused historically on the assessment, I always start with what is the desired impact and for whom, knowing that that can take years, but kind of just starting with that to kind of keep grounded on where we want to go. Next slide, please. In terms of using a framework that can help understand what are those categories and a way to communicate, you don't have to use a framework. I tend to use frameworks for the reason of creating common language and tools across many different groups. So it kind of helps with that. And there are many impact frameworks in Canada. The co-produced pathways is widely used. The other one widely used is Canadian Academy of Health Sciences. And given this with implementation sciences, this is an example from Proctor in terms of identifying outcomes when it comes to implementation science. And you can see some of these outcomes were in the Canadian Academy of Health Sciences, and they call it impact. So, but the merit is this is the way we get to outcomes. Next, please. So this is just an example of it, of the co-produced pathways, which really emphasizes, which we saw on the chat, a strong engagement between kind of the researchers, partners, and receptors. So very much working together to get to outcomes and impact. The pathway here is research, dissemination, uptake, implementation, and who benefits along the way. So here it outlines different beneficiary along the way. And I just blew out impact just because it's a bit blurry, is ultimately the desire is more productive lives for children with neurodevelopment disorders and socioeconomic. So again, how do we get there together is really key. Next, please. This is really engaging our interest holders early on. And kind of really one of the learnings is, Vanessa, that you said is, who we're working with and what they value and understanding their impacts of interest, their outcomes of interest in a way is the is really important to understand because when it comes to assessment, the starting point of the question is kind of interest holders' questions and getting evidence from them. So a different starting point than from research. So you're always wanting to make sure that we understand their interests. So the evidence is there and it's engaged in moving to that. So those conversations are key. Next. So I'm just going to kind of pause on this mountain for a moment and really what this is wanting to communicate is we are all working together for those desired outcomes and impact. And we have a lot of expertise in getting there in terms of implementation, science, knowledge, mobilization. And these are the stages that we're working towards to inch up the mountain. Now, there is a debate on whether we should be focusing on that long-term effect. My proposition is we should. Now, there is challenges in measuring and the contribution, but if we're moving beyond inputs at the beginning and activities, we are working all the time to get to those outcomes that we saw earlier. And then if we design this in at the beginning, and we can start asking questions and setting the evidence up, will we make an impact or a difference? Are we and did we? So just a way to kind of bring us all together on moving to outcomes and what are those different paths. And we have different paths. We could focus on policy practice, whatever path we choose, but it is to get to outcomes. In terms of assessment, in terms of thinking of it, it's not just the pathway we're interested in, but who are we engaging along the way, who benefits, and who can help us in our partners to get and mobilize to get to outcomes, and thinking about the beneficiaries all along the way is kind of the latest real discussions on these kind of pathways. The term I used is kind of relational pathways. Because and it's arose by many names, co-production, co-creation, etc. But I like relational because it talks to the relationships that are needed. Next, please. So just going to pause here and, thinking about your projects, which are at different levels, are there concepts here kind of that work based on your experience or work, or thinking about these analogies and different pathways, are there other concepts or wording that has really helped in towards kind of using implementation science to be more impactful for your communities? So again, happy in the chat or come off and put your hand up, or if you want, love to hear your experiences in kind of galvanizing and momenting towards getting to outcomes and impacts, considering who's going to be benefiting along the way. So just going to pause on that.
Okay, we have two people who've raised their hands. So let me
Great.
see if I can do this. All right.
Yeah.
Hi.
Hi, Asma.
Hi, everyone. Yeah, it's a very good question. And right now I am standing in that point. As I mentioned, I work with my kids. Last 5 years has I have an experience with my kids doing one-on-one. Like my 18-year-old one, and he was in just like grade 8 when the COVID started, and I just everything was shut down. So I made the decision to do everything by myself instead of just like sitting and looking around what's going to happen next. So it
Mm,
was a very, very it impact on my life, like how it impact like more being aware of my own ability to
mm,
deal with the situations and knowledge knowledge like now I'm standing how to use the knowledge in research when we are standing in a group and all together we are talking about all those points how to work together. So it's like the next step is like while doing like in the working together, the how to implement in the practical life. So my just kids in this year, they started. Why did I make the decision? Because I am working with them and everything is going good, but my own like I went through my tumor surgery, like I have the other thing, but the main thing is to give them like interaction with other people, like how in the community when we are standing, how the other kids can get benefits as a
mm,
like parent. When I was standing and waiting for those services, I know everyone is doing their best, but it is very hard to reach on that spot. So while waiting, what we can do instead of just waiting, how we can work together like on with our kids. So everything is started home. So this is the like main concept of my homeschooling. And now I'm standing in like a school zone, and my son just he started like I just put his request for him to attend 2.5 hours for him to get interaction with the new
mhm,
faces, with people. And I can stand there and I can share my experience and we can work together how to implement it with in this system. So this is my like right now I am just that's why I'm just enjoying and listening and having spending my time all on these research and work. So that's my like
Yeah, no, thanks very much, Asma. So really how to use the knowledge and how kind of to work together to implement and what are those pathways that can be used in a proactive way. So I'm going to open that up, but if there was another hand up, we'll see the response to that. Any other questions? That's good. Vanessa?
Yeah. Oh, I think there is someone else.
Someone
Sarojit.
else? Yeah. And then that's great. I'll just take one more and then we'll respond.
We can't hear you. Maybe if you want to put your comments in the chat. Um,
Right.
yeah. And we can go from there, come back to you too. And Catherine, I was just
Yeah.
thinking too, the comment earlier made me think a lot about the how do we communicate impact and some of that of
Yeah.
your work too.
Yeah, and there's some good comments in there about frameworks, can child's efforts for child development and um, asking who along that pathway could be very useful. And then to Asma's question, Vanessa, um, which is a great one, is through the networks, is there kind of a mechanism to kind of work through those pathways. So just more generally saying that, and then I'll move on. Yeah, so Vanessa, do you have any advice just in terms of those pathways, with the network or through the community?
Oh, it's a big question, and Katie and Celia, feel free to chime in here too. Yeah, I think just thinking about ways in which we can leverage the opportunities such as this that we already have for some of that sharing. Speaking of the different projects that are ongoing through KBH Plus and Child Bright, and again, how we can communicate those impacts, how we can better engage families in those projects, so that there's ways in which there is that wider reach and hopeful potential impact or benefit and connection. But it's really helpful for us to think about. So thank you.
Yeah, I'll just add briefly as well. As part of the way that Child Bright aims to work is to be able to learn from these experiences and be able to connect with others that have similar learnings, to be able to see how that impact can be larger, to be able to support more people that haven't been able to necessarily see that connection yet. So really trying to think at all of those different levels that you were talking about, and also really valued your comments around the sustainability aspect of thinking about sustainability at all of the different
Mhm.
levels, not just seeing it as a final outcome, but ways that everything can be built, and the capacity building and the connections that are formed along the way is really what we try and think about within a lot of this work.
Okay. Thank you. Thank you. So just going to move on. So the other idea of kind of the mountain is think of obviously the who, and also we want to evidence what we're doing as a way that is effective for helping with the outcome. So think of indicators along the way as an example. And I will update this slide in terms of the relationality that we're talking about. Next, please. Again, this is just an example, depending what framework you use based on your work, but this is just example of indicators along that kind of pathway, just as a reference. So really thinking of it as corroborating the evidence of the science and the practice of getting to outcomes and impact. Next, please. So, particularly for assessment, and as we said, really starting out, is impact is about making a difference. But how do we know we've made the difference? Next slide, please. So we typically use mixed methods and multiple data sources, and we use different tools along the way. And when we assess it, we tend to assess it midpoint to see what's working, not working, why, so we can adjust along the way. And then summative is we assess retrospectively at the end. Just in blue, I put developmental, which is really at the beginning of an initiative where coming together can be messy. So really acknowledging the complexity of the work that needs to be done is sometimes quite underused. And just looking at the chat is really something to highlight is really understanding those evidence-based interventions that meets the needs of the researcher and clients. So yeah, and again, that would be part of a community of practice is understanding and sharing those, I think, between. So something to flag. Next, please. Again, these are just different methods that's typically used in terms of the assessment and help with that evidence. Next, please. Yeah, and I'm just looking at the chat, and which is looking at the change in terms of the change to the beneficiaries or to those people we're trying to impact. And we always, particularly from an assessment, always look to gather evidence from those who have benefited. I just wanted to share this slide here. Vanessa, you brought it up earlier, particularly with impact and values. We value different things, and this is from the UK Research Innovation Funding Agency in the UK, is saying that often academically, the tip of the iceberg is what is valued. But underneath that, what is research and what we're trying to do is often hidden. And how do we kind of make that visible in terms of the terms of what we're trying to do and what will actually help us get to outcomes and impacts in terms of, the beliefs or mental models, etc. And yes, the complexity of what we're trying to do and not only implement but scale, to get up that mountain is hard. It's challenging, but that's what we're trying to move the science and the practice. Yeah. Next, please. So how do we know we've made the differences due to us? Next, please. And so this is understanding that it's establishing the counterfactual. In other words, those outcomes or results wouldn't have happened without us. So part of that design is making sure that we have understand those evidence-based interventions and how they've made a change and who have they made a change to. Just so you know, there's quite a big debate in the community about the attribution. If it's so far out, we can sometimes talk about contribution, but really establishing a strong case of the evidence. Next, please. So in terms of communicating, and if we think of the mountain analogy, we're working together and moving up to outcomes and impacts. We have our evidence that corroborates it. So how do we communicate that in a meaningful way to many interest groups that is relevant? Because we have many voices, but we kind of want to communicate the one song in terms of impact and who benefit. Next slide, please. So just sharing an example of work that we're looking at is and this is very much in development, but thinking of these impact narratives as a way to communicate not just the data, but the story around who was impacted. This is just an example from a researcher at the U of C in terms of body checking, changing the body checking rules in terms of girls hockey to reduce concussions. But really the story is about not only the researchers, but those relationships that were made to move the evidence into practice, in this case, policy, and kind of trusted relationships over the years that it took. Like it took years for this to happen. So the is very much understanding who was involved to mobilize this in a shared way where change happened and why it matters. Next, please. So just wanted to highlight in the UK where they assess impact as part of the Research Excellence Framework. This is the learnings of what a quality kind of impact narrative is. And as you can see, it's very much looking at the significance and who benefits. Next, please. This is a book that I co-edited, co-authored, which is really kind of focusing much more on the institutional level. So impact is hard. It's hard to scale. So if we're looking at this at an institutional level and a systems level, how do we put in the systems that are needed to help with, the data, the IT, the communications, the machinery, really, to help scale out this work for impact, where the burden isn't on one person. There is an infrastructure and system. So really, that's kind of what it's getting at, and what are those tools that can help. Next, please. So what the work I'm focusing on is how do we use the research to enhance more positive outcomes and impacts for children and families in this context. And so my kind of reflections are that a lot of the assessments have been done retrospectively because they're done for accountability, to demonstrate the impact which makes most sense. However, if we're trying to enhance our outcomes and impacts, and we design together at the beginning where we want to go and kind of use different tools that are probably underutilized, like prioritization, the partnerships, etc. And then through this pathway, very relational pathway, work together to share what's working, not working, and adapt along the way, will help us actually optimize and enhance in the long run. Next, please. So these are kind of the key messages in terms of using some of these frameworks, examples to help demonstrate and communicate. You can see it takes quite a holistic view. It takes a village here, a community, and how we start integrating more and sharing those interventions and evidence to help us know how to keep moving. Next, please. So we have a few minutes to discuss, but Vanessa, can you just go to the next slide? It's the slide at the end. I just put it in the appendix, I think. I just looked at this. I found this article focused on enhancing implementation impact. This is kind of their advice. But if you kind of go back further, just to the discussion, is really just going to pause here in terms of, I think, what would be useful for you in terms of a community of practice and network to kind of help move the practice and science together. And again, very happy to share kind of what's in my toolbox, but just going to open it up for a discussion.
Beautiful. Well, first, thank you so much, Kathryn. That was a wealth of knowledge, information, lots of tools and resources. And I really appreciate, the intentionality around this. I think impact is a term that, I myself throw around quite often without really thinking about what that means, and the process, the collaboration, all of those important steps and the ongoing process of it. And I loved your point around the adaptive management. And I think that really holds true. I wanted to quickly just note there is a Q&A submission.
Okay.
I think, yeah, I missed that. But
I,
so there's a question here from the health economics perspective, how to effectively report the economical impact of our neurodevelopmental disability research. Is there a framework to report impact within the Canadian context? Yeah.
Yeah, great question. So there are numerous economic impact assessments done in health at a kind of national and international level using economic theory. But in terms of that, but specifically in terms of the NDD, I am working with a health economist here at the U of C in looking at different focus areas in kind of how we should be assessing the economic impact. And not only that, but in a prospective foresighting way as well. And not only what the economic impact has been achieved, but how can we do it better? What was interesting when I was looking at the priorities of the enhancing the impact of implementation studies, they said, I think it was only that 10% of implementation studies included costs, I think. So there wasn't or isn't, according to this study, a good understanding of the economic impact. But I am working with a health economist, and that is the question we're asking, particularly if you're looking at, for example, an area like NDD or its mental health or focus areas. What are the economic models we should be using? So happy to follow up and kind of share something on that. But again, we'll open it up to others in that space specifically. But there are a lot of economic impact reports out of the UK. The big one was medical research, what is it worth? And it looked at, I think it was mental health, cardiovascular, but it uses all the economic modeling in that. So many examples, but kind of seeking what's happening in Canada, if anyone else knows. But I'm happy to follow up with some of the work we're doing in that area.
I can just add, not my area whatsoever, but there are some tools that are around some of the tracking of costing during implementation, to be able to make sure that all of the levels are covered in terms of how much does it even cost to actually implement something, and how do you look at that. So happy to share some of those tools
Great.
as well.
Yeah, that's great. Yeah, so maybe one idea, we can think big as always and start small, but kind of share some good studies in that kind of economic area, but in particular to NDD. I think that would be a great start. Yeah.
Great. Thank you. And I know we're almost at time, but I see another quick question in the chat here from Laura. What are some of the ways that impact can be communicated through more mainstream channels? Dr. Google, fake science, news tend to rise to the top of social media. How can this process arm families with more rigorous information to guide access and advocacy? It's a big question.
Yeah, so big discussion at the moment about the trust between science and society and what can be credible and trusted. And I think one of the conversations in impact is, social media, and also, of course, measuring it. So a lot of the social media is understood as measuring attention. But with today's ways of communicating, it is a way to get reach and engagement. So using those methods, but that can be trusted or have kind of been validated to be trusted, I think is kind of an area where we need to go to get to provide trusted, credible information. And Katie, just I know your communications, any comment on that?
Thank you, Catherine. Yes, I definitely agree with the social reach aspect of that. And speaking of like when people get on social media, especially X or Twitter, there can be that attitude of certain opinions working in silos with each other. So yes, definitely best to get the information aside from social media and the most credible publications and resources.
Yeah. Yeah.
I know we're out of time, but I'm curious. I have a question if we can sneak it in. So it's grant season right now for CIHR project grants, and I'm seeing a lot of emphasis on impact and wanting to have the policy change and have policymakers engaged when I don't think that that's necessarily the time. It's a smaller project, it's still providing value. How do you kind of navigate some of those when the desire is to have this big impact, but it doesn't necessarily align with the work that you're doing? Not that it's not important, but those kind of
So, Celia, what's the question? Is just what is,
um,
sorry.
yeah, balancing the tension when everyone wants policy impact, but not every project can reach that or should reach that.
That's right. So the way I deal with that is kind of intentionality is that our one of our pathways. So is policy one of the pathways? And because the engagement, the evidence that's needed to get to policy change is substantive. So if that is not the intent, in a way, either partner with someone or you know, how are you going to do it if really it's not the focus of the pathway? So, or collaborate with someone in the network whose intent is to move the pathway and then it's shared. Because getting to policy change is very substantive. Yeah. Yeah. And as you said, to get there takes years and you're informing it, you've and guidelines. But I'm over time, my apologies. Yeah.
No worries about the hand raise. That's okay. You've all been very patient with our hiccups in these webinars too and learning the platform. So no worries at all. Thank you so much, Kathryn. This was a fabulous session. So much information shared, so much valuable information and practical resources. I think everyone has a lot to take away and reflect on, and you can see the praise in the chat there. Just to quickly highlight, this session is recorded, so it will be shared on our community webpage. So people can go back, revisit the content, and then Kathryn, if there are any particular resources that you'd like me to circulate
Yeah.
to the attendees, I can
Yeah.
do that if you send that to me over email. But just thank you again. What a beautiful session today. And thanks everyone for taking the time to be here.
Thank you, everyone. A pleasure. Thanks, guys. Keep warm. Bye.